First aid. Concept and organizations. First aid is the immediate care before medical help. Key organizations associated with it are Red Cross, St. John Ambulance, etc. First aid. Immediate and temporary care given to an injured or ill person until professional medical help is available. Three objectives, that is the three P's of first aid: preserve life, prevent deterioration, promote recovery. Important organizations: Red Cross Society, international humanitarian organization, provides first aid training, disaster relief, and emergency medical services. St. John Ambulance, global voluntary organization, trains people in first aid and provides ambulance services. World Health Organization sets global health standards, promotes first aid awareness. National Safety Council India conducts safety and first aid training programs. Important persons in first aid history: Henry Dunant, founder of the International Red Cross. He was a Nobel Peace Prize winner. Dr. Peter Shepard, credited with developing the first systematic first aid training program in the 19th century. Florence Nightingale, pioneer of modern nursing, emphasized hygiene and emergency care during wars. Clara Barton, founder of the American Red Cross, promoted first aid services in the US. Human body basics, what we have to learn: respiration, breathing, pulse, circulation, and skeletal system. So, respiration. Definition: exchange of gases, oxygen taken in, and carbon dioxide released. Types: external respiration as well as internal respiration. External respiration: lungs exchange gases with blood. Internal respiration: cells use oxygen for energy and release carbon dioxide. Breathing: it is the mechanical inhalation and exhalation. Inhalation and exhalation. So, inhalation, the diaphragm contracts, lungs expand, air enters. Exhalation, diaphragm relaxes, lungs contract, and air exits. Pulse, it is the rhythmic beating of arteries due to heart contractions. Normal adult rate pulses approximately 72 beats per minute. Clinical use, quick indicator of circulation and heart health. Circulation system: heart pumps blood through arteries, veins, capillaries. Functions: transport oxygen and nutrients, remove waste products, maintain body temperature. Skeletal system: the framework, bonds, support, and protect organs. Functions: shape and structure. It gives shape and structure, helps movement with muscles, then protection for skull for brain, then rib cage for heart and lungs, then blood cell production like bone marrow. Resuscitation. So we have CAB or ABC rule where circulation, airway, and breathing. Mouth to mouth resuscitation, artificial respiration. CPR, chest compressions and rescue breaths. AED, automated external defibrillator. So, CAB or ABC rule: circulation, airway, and breathing. So, circulation: check pulse. If absent, start chest compressions. So, 30 compressions per cycle. Then, airway: clear mouth and throat of any obstruction. Tilt head back, lift chin. Breathing: give 2 rescue breaths after compressions. Observe chest rise. So, CAB rule or ABC rule emphasizes starting with compressions first, followed by airway and breathing, the modern CPR sequence. Then mouth to mouth resuscitation, used when the patient is not breathing but has a pulse. Steps: lay the person flat, tilt head back, pinch nose. Seal your mouth over theirs. Blow air steadily for 1 second. Watch chest rise. Repeat every 5 seconds. Then CPR, cardiopulmonary resuscitation. It is the artificial method to maintain circulation and breathing in cardiac arrest. Procedure. Place heel of one hand on chest. That is the center of sternum. Press down 5 cm deep. 100 to 120 compressions per minute. After 30 compressions, give 2 breaths. Continue until help arrives or patient revives. So CPR combines chest compressions and rescue breathing to keep oxygen flowing to vital organs. AED, automated external defibrillator. So it is a portable device that delivers an electric shock to restart heart rhythm. The steps are: turn on AED and follow voice prompts. Attach pads to chest, one upper right and one lower left. Ensure no one touches the patient. Press shock when advised. Resume CPR immediately after shock. Then choking. There are two ways like Helmish manner and back blows. So concept of choking. A condition where the airway is blocked by a foreign object, preventing normal breathing. Causes are there: food, toys, or other objects lodged in the throat or windpipe. Effect: lack of oxygen. So possible unconsciousness or death if untreated. Signs and symptoms: difficulty breathing or speaking, clutching throat, universal choking sign, bluish lips or face, cyanosis, weak cough or no sound, then panic or distress. When you see these kinds of symptoms, make sure that that person is having some first aid measures for conscious adult or child. Encourage cuffing if able. If ineffective, perform Helmish maneuver, ab- abdominal thrust. Stand behind the person, wrap arms around waist, make a fist and place it above the navel. Grasp fist with other hand and give quick upward thrust. Repeat until object is expelled. For infant under 1 year, lay baby face down on forearm. Give 5 back blows between shoulder blades. Turn baby over, give 5 chest thrusts, 2 fingers on breastbone. Alternate until breathing resumes. If person becomes unconscious, call for medical help immediately. Begin CPR, 30 compressions plus 2 breaths. Check mouth for obstruction before giving breaths. Then prevention. Chew food properly. Keep small objects away from children. Avoid talking or laughing while eating. Learn basic first aid and CPR techniques. Then cuts, wounds or amputation. Clean wound, apply pressure, bandage, control bleeding. Cuts and wounds. Break in the skin due to injury. There are different kinds of types of wounds. Incised wound, that is clean cut with a knife or a glass. Lacerated wound, irregular tear like accident or machinery kind of wounds. Puncture wound, deep, narrow due to like needle or nails. Abrasion, superficial scrap. First aid measures. Wash hands before touching wound. Clean wound with antiseptic or clean water. Apply direct pressure with sterile cloth to stop bleeding. Cover with sterile bandage. Seek medical help if wound is deep or infected. Amputation. Loss of a body part like finger, hand, limb, etc. due to accident or surgery. Danger: severe bleeding, shock, risk of infection. First aid measures. Control bleeding. Apply firm pressure with sterile dressing. Elevate injured part above heart level. Preserve amputated part. Wrap in clean, moist cloth. Place in sealed plastic bag. Keep bag on ice. Do not place directly in ice water. Transport patient and amputated part to hospital immediately. Keep patient calm, warm and reassured. Bleeding. Direct pressure, elevation, tourniquet, last resort. So, loss of blood due to injury or rupture of blood vessels. Types of bleeding: arterial bleeding, venous bleeding, and capillary bleeding. Arterial bleeding: bright red, spurts with heartbeat. Venous bleeding: dark red in color, steady flow. Capillary bleeding: oozing from small cuts or abrasions. Dangers: excessive blood loss, shock, unconsciousness, and even death. Risk of infection if wound is not cleaned properly. First aid measures: direct pressure. Press firmly with sterile cloth or bandage. Elevation: raise injured part above heart level. Pressure points: press artery supplying blood to injured area, example branchial or femoral. Then tourniquet, use only as last resort. Apply above wound, loosen every 10 to 15 minutes. Cover wound, sterile dressing or bandage to prevent infection. Seek medical help if bleeding is severe or does not stop. Summary tip, like if it is a minor bleeding, clean, cover and reassure. If it is a severe bleeding, pressure, elevate, control, then rush to the hospital. Burns, scalds and frostbite. So cool with water, cover with a sterile cloth, avoid eyes on frostbite. So burns. Injury caused by dry heat like fire, hot objects, etc. Types: first degree burn, second degree burn, and third degree burns. So, first degree burn, redness and pain. It is a superficial level. Second degree burns, blisters, severe pain will be there. Third degree burns, charred skin, nerve damage. First aid: cool burn under running water for about 10 to 15 minutes. Cover with sterile, non-stick dressing. Do not break blisters or apply ointments. Seek medical help for severe burns. Scalds: injury caused by moist heat like boiling water, steam, hot liquids, etc. First aid: same as burns. Cool with water, cover with sterile cloth. Remove wet clothing carefully. Avoid ice or greasy substances. Frostbite: injury caused by freezing of skin and underlying tissues. Signs: pale, hard, numb skin. Blisters in severe cases. First aid: move patient to warm environment. Warm affected area gradually with lukewarm water, body warmth, etc. Do not rub or massage the area. Cover with dry, sterile dressing. Seek medical help immediately. Summary tip: burns and scalds, cool cover, then don't break blisters. If it is frostbite, warm gradually. Don't rub, protect, seek help. Fractures. Different kinds of fractures are there: simple, compound, and complicated. So, immobilize, splint, avoid movement. Fractures: a break or crack in a bone due to injury, accident, or disease. Danger: pain, swelling, deformity, loss of function, risk of internal bleeding. Types of fractures: simple or closed one, that is, bone breaks but skin remains intact. Compound or open one, bone pierces skin, risk of infection. And green stick, incomplete break, common in children. Comminuted: Bone shatters into several pieces. Impacted, broken ends driven in each other. Depressed, bone pressed inward, common in skull injuries. Pathological, fracture due to some diseases like osteoporosis, cancer, etc. First aid measures. Do not move the injured person unnecessarily. Immobilize the affected part using a splint or sling. Control bleeding if present. Apply pressure, cover wound. Support the injured limb in a comfortable position. Do not attempt to push bone back into place. Apply cold compress to reduce swelling. Seek medical help immediately. Summary tip. Fractures first aid means immobilize, control bleeding, prevent shock and rush to hospital. Snake bite. Keep patient calm, immobilize limb, avoid cutting or sucking and rush to hospital. So, injury caused by venomous or non-venomous snake bite. Danger. Venom may affect blood, nerves or tissues. Can be fatal if untreated. Signs and symptoms. Fang marks at the bite site. Pain, swelling and redness can be seen. Nausea, sweating, anxiety. Difficulty breathing, blurred vision like neurotoxic bites. Bleeding disorders, hemotoxic bites. First aid measures. Keep patient calm and still. Movement spreads venom faster. Immobilize bitten limb. Keep below heart level. Remove tight items like rings, bangles, shoes, etc. before swelling starts. What are the dons? Do not cut or suck the wound. Do not apply ice or chemicals on the wound. Do not use tight tourniquets. Then apply a broad, firm bandage. Pressure immobilization technique if advised for neurotoxic bites. Transport immediately to hospital for anti-venom treatment. Monitor vital signs like breathing, pulse, etc. and be ready to give CPR if necessary. Prevention. Avoid walking barefoot in snake-prone areas. Use torchlight at night outdoors. Do not handle or provoke snakes. Educate communities about snakebite risk and first aid. Summary tip. Snakebite, the first aid will be stay calm, immobilize, avoid harmful practices like sucking the blood, etc. Rush to hospital for anti-venom.